Hello everyone. Good morning. A very good morning to all of you. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to take a very important topic from community medicine. That is one of the important topic from community medicine we are going to discuss here is case control study. So can we start case control study? So you get many conceptual questions from the epidemiological studies as well as numericals. So we are going to discuss completely here the case control study. So can we start? Very good morning to all of you. So let's start it. Give me a minute to start. So just a second. Okay. So epidemiological studies. Here you can see the epidemiological studies. How many type of epidemiological studies are there? There are two type of epidemiological studies, the observational studies and experimental studies. So in the observational studies, there are two things. First, we do descriptive study and then we do analytic study. So today I am teaching you case control study, which is a type of analytic study, and followed by we do the experimental studies, in which the most common study is randomized controlled trial, that is RCT. So I will explain you all these one by one. Just have a look that what does it mean. So this is the diagram. You can see the various types of epidemiological study. Now you may be thinking, ma'am, why at all we conduct an epidemiological study? Why? What is the need of conducting an epidemiological study? We conduct a epidemiological study to prove any hypothesis. Okay, just for suppose I'm saying smoking leads to lung cancer. You say, ma'am, we know that smoking leads to lung cancer. You know because it is proven thousands of times by different investigators, different scientists. But imagine the first time we are going to prove that smoking leads to lung cancer. It is not yet proven. And first time we are going to prove that smoking leads to lung cancer. So whenever we want to prove any hypothesis, Hana, if I say something, so there is a cause. Here smoking, I will call the smoking as a cause, and I will call the lung cancer as the effect. So smoking is the cause which is leading to an effect, that is lung cancer. Or else smoking is the risk factor, smoking is the exposure which is leading to a disease or an effect, that is lung cancer. So it is already proven, that's why you believe me. But if suppose I say any cause leads to any disease, you will not believe me. For example, if I say eating mangoes leads to blindness, will you believe me? Say, ma'am, I have not heard it and it is not proven yet, like eating mangoes leading to blindness. So can you please prove it? So if I want to prove any hypothesis, there is a particular cause or risk factor which leads to a particular effect or disease, we have to conduct the epidemiological studies. So this is the purpose of the epidemiological studies. You got my point? So we are conducting the epidemiological studies to prove a hypothesis. In every hypothesis, whatever hypothesis I'm going to prove, Anna, in every hypothesis, there is a cause or exposure or risk factor which leads to effect or disease. Here we take the example smoking leads to lung cancer. Now I know it is already proven, but imagine we are going to prove it first time, it is not yet proven. So we are having a cause, that is smoking, and we are having an effect or disease, that is lung cancer. So I will prove that smoking leads to lung cancer with the help of these studies. So if I am the investigator and I want to prove this hypothesis, so first of all, I have to perform descriptive study. In descriptive study, what we do, we formulate the hypothesis. The hypothesis is formulated that smoking how many cigarettes, how many BDs in one day leads to lung cancer in how many years. So there is a hypothesis we will frame. So in descriptive study, we just describe the hypothesis. We don't measure it. We just describe it. In terms of time, place, and person. We just describe it. And we formulate our hypothesis. Formulation of hypothesis takes place in descriptive study. That is number one. Got my point? Now, second, after descriptive studies, if we have done the descriptive studies, now we will move to the analytic study. In analytic study, we measure. And now what we do? We measure the hypothesis. We test our hypothesis. So there are various ways of doing analytic studies. The two most important we use is case control and cohort. So among the two, today I am going to discuss the case control. I will compare it with cohort also. Okay, but we will first discuss the case control. How many of you got it? So here we will test the hypothesis. And finally, if this is also done, if we test the hypothesis, finally we will do the experiments. So it is the experimental study in which the most common is randomized control trial, RCT. So in which we intervene. In experimental studies, we intervene. In observational studies, we don't intervene. Whatever is happening, we are just observing it. We are just observing it. We are just measuring it. We are not intervening. But in experimental studies, we intervene. We intervene in between. Here, if I want to prove that smoking leads to lung cancer, this is my hypothesis. So I will not ask anyone to start smoking. I will not ask anyone to stop or quit smoking. No, no. Whatever is happening, let it happen. The smoker is the smoker. I will just observe and see what are the chances of lung cancer in this person. The non-smoker is the person. I will not ask him to start smoking. So we are not intervening here. It is just an observation. It is just an observation. Okay, the person who is already exposed to risk factor, the person who is devoid of risk factor, we are just observing them, which of them is having the disease in future. Or we will see the exposure in the past and we will see the disease now. Okay, so we are just observing. We are not intervening. And in experimental, we intervene. How many of you got it? So can we go ahead? So let's start the case control study. In analytic study, the first study I'm teaching you the case control. So there are two types of analytic study. Mainly we use case control and cohort. So here I'm teaching you case control study. So in case control study, I will take the same example throughout. Smoking leads to lung cancer. I know it's proven, but we just suppose we are going to prove it by the case control study. So what is the design of case control study? Why case control study is known as case control study? In case control study, we take cases and we take control. We take two groups of population and we compare them. That's why it is known as case control. So see the design, you will understand by your own. See, I'm the investigator. I want to prove this hypothesis. Smoking leads to lung cancer. I'm the investigator. I want to prove it. So what I will do? I will take a population. The population can be anything. So it is my defined population. The population can be Delhi population, can be Mumbai population, can be a particular community. So I will define that my population is this. Okay, having total number of members this. Out of which these are males, these are females. This is the age group distribution. So this is my population under study. So we can take any population. From that population, what is my hypothesis? My hypothesis, never forget, my hypothesis remains the same throughout. Smoking leads to lung cancer. This is my hypothesis. Now from that population, I will take 100 patients of the lung cancer. So I will call them cases. These are my cases. These are my cases. I will take 100 cases from my population. Imagine my population is Delhi population. From the Delhi, or I will define a community in a Delhi. So that is my population under study. The larger is the sample group, the larger is the population, better are the results. More, you can rely the results more. Okay, so better if the sample size is more. So the population you have to take as big as possible. The sample is big. For example, whatever is our population, we are taking 100 lung cancer patients from that population. So from where you will obtain the 100 lung cancer patients together. From some oncology hospital, from some cancer hospital, you will get the data and you can contact the 100 patients who are already diagnosed with the lung cancer. So we will contact them and we will ask them to participate in our study. So I will call them 100 cases because here the disease is present. They already have the disease. My disease under study currently is lung cancer. Okay, it depends from hypothesis to hypothesis. Currently, my hypothesis is smoking leads to lung cancer. So my disease is lung cancer. So I have taken 100 patients which is having disease. So disease present. Okay, and I will take 100 control. You will say, ma'am, who are control? Control is anyone in which the lung cancer is absent. The lung cancer. Any other disease may be present. Maybe these may have TB, these may have some other disease. They may have diabetes, but in them the lung cancer is absent. Okay, so disease under study. Which is our disease under study right now? It's lung cancer. It is absent in these persons. So I will call them 100 controls. And apart from the disease, everything should be same in cases and control. More and more matching should be there. So their age should be match. Out of the 100, just suppose here 50 males, 50 females are there. So in the control group also, ideally we should take 50 males, 50 females. So the gender we are matching. The age group we should match. So apart from one thing, the disease present and disease absent, more and more factors we should match. So matching, so that results are more reliable. You got my point? So we are taking 100 cases and 100 control. 100 cases are the persons in which the disease is present and 100 are the controls in which disease is absent. Okay, so now what we will do? I will call them in where we are doing the study. For example, this is my office and here we are performing the case control study. I am the investigator and I want to prove that smoking leads to lung cancer. So to participate in my study, I called 100 cases. These are the 100 cases standing in front of me. They all have lung cancer. They are proven. They have proven that they have the lung cancer. It is proven. Okay. And these are the 100 controls. They're also standing in front of me. Here 100 cases. Here 100 control. Control don't have the disease. Now what I will do, I will call them one by one and ask them. I will take the history. I will take the history that in last 10 years or last 15 years, do you smoke? Yes or no? If you smoke, what is the frequency? Do you smoke cigarette, BD or what? And what is the frequency? In one day, how many cigarettes, how many BDs? So I will take the history of exposure. Here this exposure is smoking. My hypothesis is smoking leads to lung cancer. I started with lung cancer and I am asking for the exposure. So among the cases, I will divide the cases into two groups. You can see some of them say yes, we smoke. We do smoke in the past, but after the disease, we quit. But we do smoke since last 10 years, 20 years, whatever. And among the cases, there may be a population which say, no, ma'am, we don't smoke. Still, we have the lung cancer. We are unfortunate people. We never smoked in life, but still we have the lung cancer. So I divide the cases into two groups, exposed and non-exposed. Exposed are the people who smoke and they have the lung cancer. And non-exposed are the people who don't have who don't smoke till date, but still they have the lung cancer. So among cases, I divide them into two groups. Among the controls also, again I divide them into two groups. Controls also, I will call them one by one and ask the same question. Do you smoke in the past, in the last 10 years, 20 years? Say yes or say no. Got it? So here also some will say yes, we smoke, and some will say no, we don't smoke. Got my point? So finally, I divided the population, my population under study into four groups. Hana. So cases also I divided into two groups, the one who smoke, the one who do not smoke. And controls also I divide into two groups, the one who smoke, the one who do not smoke. That is exposed, unexposed, exposed, unexposed. How many of you got it? Okay. So this is the design of case control study. We take cases, we take control. So we start with a population, you can see. And from the population, we take cases. For example, we take 100 cases. It's not always 100. 100 is just a number for understanding. You can take 1,000, you can take 10,000. Larger is the sample, reliable will be the results. I told you. And we take 100 controls. What is the case? What is the control? Can you tell me the definition of a case? Case is any person in which the disease under study is present. Control is any person in which disease under study is absent. So we take 100 cases, we take 100 control, and we divide them into two groups. We will take the history. I will call each of them and ask them, do you smoke? Yes, no, yes, no, yes, no. So out of the cases, some smoke, some do not smoke. Some are exposed, some are not exposed. Out of the control also, some are exposed, some are not exposed. So I have divided them into four groups. How many of you got it? Give me a thumbs up if you got it. You got this? So this is how we are performing. So basically, we are starting our study today. So what is the date today? So I am performing my study in January 2024. Okay. So this is the date I have started my study. Okay. In January 2024, I am doing my study and I am taking the history of the past 15 years. So that since last 15 years, do you smoke or do not smoke? So from present, I am going in the past. Look at the arrow. So that's why this study is known as retrospective study. This study is known as retrospective study. Got my point? Because we are taking the history, we are going in the past. So we are starting present, that is 2024, and we are going in the past. I'm taking the history since last 15 years. You have smoked or you have not smoked. So out of the 100 cancers, some will say yes, we smoke. Some say we do not smoke. And out of the 100 controls also, some will say we smoke. Some say we do not smoke. Okay, so I will divide. I will note down the number. How many among the cases smoke and don't smoke? And how many among the controls smoke and don't smoke? That is exposed and unexposed. This is how I divided the population into four groups. Got my point? So that's why since we are going in the past, from present to past, we are taking the history. The main thing here is the history. We are taking the history. This study is known as retrospective study. It is also known as backward looking study. The meaning is the same. It is also known as effect to cause because we started with effect. Can you see? We started with effect. Effect is our disease, lung cancer. The patient already have the lung cancer and we are going towards the cause. We started with effect. First, we have taken the cases and then we taken the history that do you smoke or don't smoke. So we are going towards effect to cause. Or you can say outcome to exposure, or you can say disease to risk factor. Whatever you say, the meaning is the same. So we started with effect, outcome, or disease first, and then we take a history to know about the cause, exposure, or risk factor. So this is the study. This is the design of the study. It is known as retrospective study. Hannah, it is known as retrospective study, backward looking study. So that is the design. You can understand. Now, there is one more study, as I told you, that is cohort study. Let me tell you the design of the cohort study also. So you can see here in cohort study, there is a population. Can you see? This is the population. Now from the population, I will take 100 smokers and 100 non-smokers. See, what is the starting point? What was the starting point in case control study? I started with 100 cases and 100 controls. Here I started with 100 smoker and 100 non-smoker. I have started with 100 smoker and 100 non-smoker. You can see from the population. The starting point is exposure. The starting point is not disease. The starting point is the exposure. So we started with 100 smoker, which are very easy to find nowadays. And we started with 100 non-smoker. So 100 smoker, I will call them exposed. They are already exposed. They smoke. I will not ask them to quit. I will ask them to continue. And 100 non-smokers. Okay, they are not smoking. We will not intervene. Whatever whosoever is doing, we will just observe. Okay. Now what I will do? I will call 100 smokers. They are standing this side. I will call 100 non-smokers. They are standing this side. So I will just call them one by one and take their details, their address, their mobile number, their email ID, their contact ID. I will take all the contact ID and ask them to go. Now I will do follow up for the next 10 years, 10, 20 years. Follow up. है ना? So every month I call them, each of them. Do you have lung cancer? Do you have lung cancer? Do you have lung cancer? Got my point? So every month or every week or every month we will call them at a frequency, at a fixed frequency, and we will ask them, do you have lung cancer? If they don't receive the call, we will visit, okay, at their place and to see how many of them have lung cancer in future. So after 10 years, we will do the follow-up, for example, 10 years. Okay. So after 10 years, among the smoker, some will have lung cancer, some will not have lung cancer. And after 10 years, among the non-smokers also, some will have lung cancer, some will not have lung cancer. So again, I have divided the population into 4 groups. But here, see, what is the starting point? What is the end point? See, in the last study, the starting point you can see was the disease and the end point is exposure. We started with the cases and ended with the exposure. You got my point? We started with the disease and ended with the exposure. That's why it is retrospective study. We were doing the history. We were taking the history. And here we are doing the follow-up in the future. So here in the study, in cohort study, I'm starting my study today. That is 2024, January. And I will do the follow-up for the next 10 years. I will end my study in 2034. So that's why this study is known as prospective study. It is known as forward-looking study. Okay. In contrast to case control. So you have to understand the two designs. They are in front of you. Please understand the two designs of the study. Both of them are analytic studies. How many of you got it? Give me a thumbs up. Give me a thumbs up. So these are the two types of the studies you can see. One is case control study. You can see here. And one is cohort study. You can see here. There are two types of study. Case control study, cohort study. So in case control study, we start with 100 cases and 100 controls. That is, we start with disease. Disease present, disease absent. 100 people with disease present, 100 people with disease absent. And we take a history and go in the past. And we ask them, how many of them are exposed, non-exposed, exposed, non-exposed. On the contrary, in cohort study, we start with 100 people who are exposed, exposure present. That is, they are smokers, and 100 people who are non-exposure. They are non-exposed. Okay, so here exposure is absent. So the starting point is exposure, and we go in the future. We do the follow-up here. We go in the future. We do the follow-up, and again we divide them in 4 groups. Some of them will have disease in the future, some of them will not have in each of the group. So see the starting point, see the end point. So that's why case control study is known as retrospective study. We are going backward looking study. And cohort study is known as prospective study or forward looking study. Here the main thing is the history, and here the main thing is the follow-up. Okay, so they have pros and cons, advantages and disadvantages in both the study. Can you tell me the advantages here in case control? You will say, ma'am, advantage, it's very fast. We can complete this study in 1 day. So what is the date today? Today is 12th of January 2024. So on today, just suppose I want to prove smoking leads to lung cancer. So what I have to do? If I want to prove with this study, smoking leads to lung cancer, what I have to do? I have to take 100 cases this side, 100 control this side. I will call them one by one. Ask them, do you smoke? Yes, no, yes, no, yes, no. So out of the 100 cases, how many smoke? How many do not smoke? Out of the 100 control, how many smoke? How many do not smoke? I have to just take the history. And once the data is with me, I can do the analysis. I will tell you how to do the analysis. So study can be completed very fast. It's inexpensive. We have to just take the history, nothing else. It's inexpensive. It's very fast. It's inexpensive. And there is no ethical problem also. The people who already have the lung cancer, he has the lung cancer. The one who do not have, right? We are just taking the history. We cannot change the past. Got my point? There is no ethical problem in that. Got it? So these are the advantages. It's fast. It's cheap. It's inexpensive. There is no ethical problem. because we have not intervened, and the person already have the disease. We cannot stop it. The person who already have the disease, they already have. We cannot change the past. Okay, so there is no. But there is a problem in this study. What's the disadvantage? The disadvantage is the recall. It is totally based on the memory of the people. Okay, so you have to take the history. I'm saying you have to take the history. You don't know whether the person is saying lie or truth. Hana, you are asking, do you smoke? Now some people can say, I don't remember. So what to do? Hana, there is no record of that. If the record is there, you have to check the record. But there is no record, of course, for smoking. Of course. So you have to trust whatever the person is saying. So recall bias is always a problem here. So the advantage is it's cheap, it's inexpensive, it's fast, there is no ethical problem. But the disadvantage, there is always a recall problem. Now, whatever the disadvantage here is the advantage here, whatever the advantage here is the disadvantage here. You are getting my point. So in cohort study, you can see in cohort study, we are doing the follow-up. Here we are doing the follow-up in the future. We started the study today in 2024. Hannah, we started with 100 smoker, 100 non-smoker. And we will do the follow-up for the next 10 years. So in the next 10 years, with our own eyes, we will see who have the cancer. Who we will call them. Do you have cancer? If they say yes, we will go and check the records. Hannah, so there is no recall. Hannah, we will ourselves check whether the person have the cancer or do not have the cancer. Okay, we can check by ourselves. So there is no recall bias. There is no recall bias, but it requires 10 years of duration. Okay, follow-up is required. So it's very, time consuming. This was conducted in a day. This requires 10 years. So this is time consuming. Okay, and this requires money also, because for follow-up, you requires money. For history taking, you don't require money. You just call the people and ask, do you smoke, do you smoke, do you smoke? It don't require any, money. But here for follow-up, you have to call them, you have to email them, you have to send someone to their address. So it requires resources. It requires money for doing the follow-up of these exposed and unexposed people for the next 10, 20 years. So it is expensive. It is time consuming. It is expensive. Okay, but the only advantage here, there is no recall problem. And here ethical problem is also there. The person who are smoking, these 100 are smokers and these 100 are non-smokers. So being a scientist, I know, being a doctor, I know that the smokers have high chances of lung cancer in future and the non-smokers have less chances of lung cancer in future. So there may be an ethical problem. We can stop the smokers now. We can ask them to stop the smoking, but due to the study, we are not intervening. We want them to continue the smoke. So there may be an ethical problem. So ethical problems can be there. You got my point. So ethical problems is always a part of cohort study, never case control. So I told you whatever the advantage here are the disadvantage here, whatever the disadvantage here are the advantage here. That is the pros and cons of the two type of the study. So this is case control study, this is cohort study. Case control study, you can see we are starting with a population and going in the past. Okay, and in cohort study, we are starting with the population and going in the future. So you got the two studies. I hope you got it. Say yes if you got it. Can we go ahead? So what are the steps of the case control? Let's continue with case control. Let's continue with the case control. What are the steps? The first step, select your population. Select your population. Okay, the first step, select your population, and from your population, select the cases and select the controls. So from your population, you have to select the cases as well as control. So who's the case? I told you, case is any person in which the disease is present. So there should be a diagnostic criteria to whom you will call the disease. For example, my hypothesis is smoking leads to lung cancer. So if some person has the lung cancer, what is my criteria? Is it biopsy proven? Is it there on the CT scan or some imaging? So there should be a criteria that this person having biopsy proven lung cancer, then only I will include it in my study. Okay, so there should be eligibility criteria, whatever is the diagnostic criteria. And control is similar person, the similar age group, similar everything. Only thing, the disease is absent. So select your cases, select your control. After that, do the matching. So cases and control should be similar in all aspects except the disease under study. Okay. After that, measure the exposure. You have to take the history. Measure the exposure means take the history. Call each of them and ask the history. Do you smoke? Yes, no, yes, no, yes, no. If yes, what is the, intensity? I mean, how many cigarettes in one day? And finally, you have to do the analysis. So let's come on the analytic part. So for analytic part, we have to make a table. This is 2x2 table. Please understand how to make this table. Please, everyone, how to make this table. So always take disease at the top. Always take disease at the top. Disease present, disease absent. And always take exposure on the left-hand corner. Always, it's a rule. So exposure present, exposure absent. By doing so, I am dividing the table into 4 columns. Can you see? That is 2 into 2 table. Okay. Now let me write ABCD. Let me explain you the meaning of the ABCD. Please everyone. See here. What is A? A is the person in which the person who smoke and the disease is also present, who also have the lung cancer. He's a smoker. A is a person who smoked since the last 10 years, 15 years, 20 years, and now he has the lung cancer. So both things are present, the exposure as well as disease. So smoking is there, the history of smoking is there, and he has the lung cancer. So okay, we got it. And who's D? Who's D? Now tell me who's D. Who's D? So D is the person who don't smoke. Till date who has never smoked and he don't have the lung cancer. So both the things are absent. Exposure is also absent and disease is also absent. So A and D are very easy to understand. You can see in A, you can see both the things are positive. In A, both the things are positive. In D, both the things are negative. You can see. Okay. Now what about the B and C? So you have to understand B and C are unlucky people. Who is B? Who is B? B is a person who smoke. The exposure is present, but who don't have lung cancer yet. So he's lucky, you can say. He smoke. The exposure is present. You can see the exposure is present. The exposure is present, but the lung cancer is absent. That is B. And who is C? They are the most unluckiest among the four. They are the most unluckiest. They have never smoked, but still they have the lung cancer. Due to some other cause, due to pollution or maybe something else, they have the lung cancer. They have never smoked. They have never smoked. So please understand the meaning of ABCD. If you don't change the sequence, you can learn the formulas. So how to make this 2 by 2 table? Always learn, write down disease at the top. Disease present, disease absent. Make 2 columns here. Disease present, disease absent like this. Okay, disease present, disease absent. And always write down exposure at the left hand corner. Exposure present, exposure absent. And make 2 by 2 table. Always write down in the sequence. First A, in which both the things are present. Then D, in which both the things are absent. You can see in A, both are present. You can see both are present. The A is the person in which exposure, the person who smoke as well as having the lung cancer. Exposure and disease both are present. And D is the person in which exposure and disease both are absent, who don't smoke and who don't have the lung cancer. So there is no problem in A and D. But you have to understand what is B and C. So you have to learn this is B and this is C. If you don't change the sequence, now ABCD is fixed and you can learn the formulas. But if you changed anything, now everything will be, the formulas you cannot learn, and on the spot you have to then you have to use your common sense and then derive the formulas. So this is the table I'm telling you. Disease at the top, exposure at the left hand corner. So you have to write down ABCD. You got the meaning of ABCD. Okay, so this is the meaning of the ABCD. Now for analysis, we have to calculate 2 things, exposure rate and odd ratio. For analysis, we have to do 2 things. I will tell you exposure rate, how to calculate exposure rate from this, and how to calculate odd ratio from this. You may be thinking, ma'am, why we are calculating 2 different things? Exposure rate tells us whether the association is present or absent. What is my hypothesis? Never forget my hypothesis. My hypothesis is same. Smoking leads to lung cancer. This is my hypothesis. Okay. Now maybe, it is by chance. Smoking do not lead to lung cancer. Maybe by chance. मुझे ऐसा देख के लगा कि smoking से lung cancer होता है. Just suppose it is not my hypothesis. My hypothesis is something else. Eating mangoes leads to blindness. So maybe it is by chance I found it. There is no actual association between that. So what is association? Association is something when 2 things always occur together. They have a frequency to occur together. They have a tendency to occur together. So that is the association. Okay. So here actually association is there or not there, that we will get from the exposure rate. Now if the association is there, what is the strength of association? For understanding the strength of association, we have to calculate the odd ratio. I will explain. Okay. So first calculate the exposure rate. How to calculate the exposure rate? Now please, you can do the calculation. See. Tell me the exposure rate among cases and exposure rate among control. Tell me how many total cases are there. Look at the table above. Have a look on the table above. Can you see the table? In the table, tell me how many total cases are there. Total cases is A plus C. Can you see? Cases is the person in which disease is present. So out of A plus C, how many are exposed? How many smoke? A plus C are the person जिनमें total disease है. उनमें से smoke कितने करते हैं? How many of them smoke? So exposure is present only in A. So out of A plus C, total the person who have the disease, exposure is present in A. So that is the exposure rate. So A upon A plus C. So out of A plus C, these are the total patient of lung cancer. A smoke, C do not smoke. Okay, into 100. So that is the exposure rate among cases. Okay, coming on the exposure rate among control. Tell me total control. How many total controls are there? Total control are B plus D. Can you see B plus D? Total controls are B plus D. They don't have the disease. So out of the total control B plus D, how many smoke? So out of B plus D, you can see only B is smoking. Here B is smoking. D do not smoke. D do not smoke. So it is B upon B plus D. So that is the exposure rate among control. Now I have given you an example. Now let me go on that slide. Listen. You can see this example and we can calculate the exposure rate in cases as well as control. The numbers are given in front of you. Just suppose I'm doing this study and I got this result. Imagine I'm the investigator. Hana, there are 100 cases this side, there are 100 control this side. They all have the lung cancer and they don't have the lung cancer. Each and everyone I will call and I will ask, do you smoke, do you smoke, do you smoke? So among the 100 lung cancer patient, 70 are smoker and 30 are non-smoker. Okay, for example, among these 100 cases. And among these 100 controls, these are 100 controls, only 10 smoke and 90 do not smoke, for example. So can you calculate the exposure rate in both of them? Hana? So if you see here, the exposure rate here is A upon A plus C. This is A, this is C, this is B, this is D. A upon A plus C, it is 70 upon 70 plus 30. That is 100. And here 10 upon 10 plus 90. That is 10 upon 100. So here answer is 70%. Here answer is 10%. How many of you got it? This is how we calculate the exposure rate. So you can clearly see the exposure rate among cases is more than control. If the exposure rate among cases is more than control, there is a clear-cut association. Okay, got my point? So this is how we calculate the exposure rate. So first rule, make this table. After making this table, calculate the exposure rate among cases. The answer is A upon A plus C. And calculate the exposure rate among control. The answer is B upon B plus D. If the answer of A upon A plus C is greater than B plus D, this means that association is present. If this answer is less by any chance, so association is not present. Association is not present. If this is greater than, only association is present. So if you want to prove between the cause and the effect association is there, you have to prove that A upon A plus C, the answer of this is greater than B upon B plus D. Got my point? So this is how we measure the exposure rate and we find whether association is present or absent. So always first make this table. Okay, first make this table. You can see the table. Okay, from this table, calculate A upon A plus C. Calculate A upon A plus C and B upon B plus D. And see, if this answer is greater than this answer, it means the association is present. Smoking leads to lung cancer. This hypothesis is true. Now tell me the strength. How much smoke? How is the risk? Just suppose there is a person who is smoking 10 cigarettes per day or 5 cigarettes or 20 cigarettes per day. So what is the risk of lung cancer in that person as compared to another person who don't smoke? So tell me the strength. भाई association है वो तो मान लिया, smoking leads to lung cancer वो भी मान लिया, लेकिन कितना strongly they are associated. So to calculate the strength of association, now association is present, we have already proven it, है ना, by exposure rate. Now to calculate the strength of association, you have to calculate the odd ratio. You have to calculate the odd ratio. Okay, what is odd ratio? Odd ratio is cross product ratio. What do you mean by cross product ratio? In the same table, you will do the cross product. What do you mean by cross product? We will take the ratio of AD upon BC. Can you see the cross product? It's a cross product. It's AD upon BC. The formula is AD upon BC. AD upon BC. We will calculate. So A into D upon B into C. We will calculate. It's a ratio. That's why it's known as odd ratio. It is known as cross product ratio. Now there are three possibilities. What is odd ratio? What is odd ratio? You tell me the formula. You say, ma'am, cross product AD upon BC. Now there are three possibilities. Either both of them will be same and they cancel each out and answer is 1. So either it is 1, okay, or it is less than 1. Less than 1 means BC is greater than AD, or it is more than 1. More than 1 means AD is greater than BC. So there are only three possibilities. Either they are equal, they cancel each out, or AD is greater than BC, so answer is more than 1, or BC is greater than AD, so answer is less than 1. Okay, so if it is equal to 1, it means there is no association. There is no association between smoking and lung cancer. Smoking and lung cancer are two different things. By chance, I feel that they occur together, but there is no association between them. If odd ratio is 1. If odd ratio is greater than 1, it means there is a positive association. Positive association. Or jitna bada answer, larger the answer, stronger is the strength of association. For example, if it is more than 1, the answer is 2, the answer is 3, 4, 5, 6, whatever. Answer is more than 1. So that times the person is having high chances of developing lung cancer as compared to other person. For example, there are two person Ram and Sham, A and B. A smoke, B don't smoke. Ram smoke and Sham do. For example, A smoke and B do not smoke. For example, so if I calculate in this study, the odd ratio is 3. So the person is having 3 times more chances of developing lung cancer as compared to B. So that is the, it's not times more chances. That is the meaning of the odd ratio. It is telling us the strength of association. And if it is more than 1, there is a positive association. But what if there is, the answer is less than 1? Less than 1 means there is negative association. What do you mean by negative association? Negative association means protective. You know, if it was very good, if the answer is less than 1 in this hypothesis, I will say smoking protect lung cancer. ऐसा होता तो कितना अच्छा होता. I also smoke. I don't smoke, but if this was true, I also start smoking. है ना? Every one of us smoke. We promote smoking. Yes, everyone should smoke because smoking protect lung cancer. But unfortunately, this is not true. This is not true because this hypothesis is tested hundreds of times by various investigators. Every time we get this result, it is more than 1. But imagine if it is less than 1. If it is less than 1, it is a protective effect. It is a negative association. So that is the meaning of the odd ratio. So there are 3 possibilities. They are in front of you. Odd ratio equal to 1 means no association. More than 1 means positive association. And less than 1 means negative association or a protective rule. So that is the meaning of the odd ratio. How many of you got it? You got it? So we are done with case control study. Now can we compare case control and cohort? I already told you there are 2 types of study and we have seen the pros and cons. You can read the pros and cons. We will solve some MCQs on case control study. The first question is in front of you. Can you read the question and tell me the answer? If the odd ratio is equal to 1. If the odd ratio is equal to 1. So what does it mean? What does it mean? The association is what? The association between the cause and effect is perfect. It's low, it's high, or does not exist. The association between cause and effect is low or high or does not exist or is perfect. Can you tell me what is the correct answer here? If the odd ratio is equal to 1. I told you, there are 3 possibilities. Yes, very correct. If the odd ratio is 1, it means their association does not exist. The cause and the effect, these are 2 different entities and they are not at all associated with each other. Absolutely right. Yes, Suraj, absolutely right. The correct answer is D. Okay. So the correct answer is D. Coming on the next question. Which of the following is true about case control study? Okay. I forgot to tell you here. Compare the 2 studies. Listen, these are the 2 studies now. What is the starting point in case control? See case control. Can you see the case control study? In the case control study, we are starting with 100 cases and 100 control. What is the case? Case is the person in which disease is present. So we are having 100% in which the lung cancer is present or that particular disease is present, and 100% in which the disease is absent. Got it? So we are starting with disease. So whatever is the starting point now, it's good to study that thing. So case control study is good for studying rare disease. Because if the disease is even rare, we can start from that now. Lung cancer is not very common disease. It's rare. It's not very common. Every now and then we found lung cancer patient. No, it's not that way common. So we are starting with the 100 lung cancer patient. I told you we will go to some oncology hospital, some cancer hospital, and we will collect the data from there and we will start from here. So to study the rare disease, case control is good. But what is the starting point of cohort study? In cohort study, we are starting with exposure. So we are having 100 smokers and 100 non-smokers. That is 100 exposed and 100 non-exposed. So this one is good. The cohort study is good for studying rare exposure. So whatever is the starting point, that study is good to study that thing. Got my point? If you want to study a rare disease, go with case control. If you want to study a rare exposure, go with cohort study. Because that is the starting point in that study. I hope you got it. Now read the next question. I hope you will be able to solve that. So the next question is, which of the following is true about case control study? Minimal problem of bias. Minimal problem of bias. I don't think it's correct because there is a problem of recall bias. Because case control is depend on recall of the patient. It is depending on the history. So recall bias is there. This is wrong. Is it time consuming? No, it is conducted in just 1 day. Is it expensive? No, we just take history. No expenses. It's cheap. Is it easy to measure the incidence? No, we can't measure incidence. We measure exposure rate among cases and control. Incidence is measured in cohort study. And is it suitable to investigate a rare disease? Yes, this option is correct. It is suitable to study the rare disease. Absolutely correct. Okay, so correct answer is this. So case control is good to study the rare disease and cohort study is good to study the rare exposure. Got it? Now coming on the next question. Cross product ratio is calculated from which study? Is it cohort study, case control study, cross-sectional study, or ecological? By cross-product ratio, I mean the odd ratio. Odd ratio is a cross-product, AD upon BC. So, of course, it is done in case control. Whenever I will teach you the cohort study in detail, I will tell you equivalent to odd ratio, we have relative risk there. So, we calculate relative risk there. Here we have odd ratio. Okay, now can you identify the pattern? Currently I taught you only one study, so this question looks very easy to you, but whenever I will teach you various types of study, like after case control we have cohort also. We have three type of cohort: prospective cohort, retrospective cohort, है ना, and both prospective as well as so looking at the, we have nested cohort also. So looking at the pattern you will get confused, but currently the question looks very simple to you. Can you identify the pattern? So in this you see what is the starting point. We are starting with 100 diseased, 100 non-diseased, and we are going in the past. We are reviewing the records. We are going in the past. You can see, look at the arrows, and we are looking for the exposure: present, absent, present, absent. So look at the arrows. We are going in the past. So this study is typical case control study. It is a pattern of the case control study. So here this type of questions are very, very commonly asked, in which they ask you the pattern. Okay, now one numerical we will solve based on this. In an investigation to study the effect of smoking on renal cancer, we are seeing this effect of smoking not on lung cancer, on the renal cell carcinoma, on the kidney cancer. It is observed that 30 out of 50 patients were smoker as compared to 10 out of 50 control subjects. You got my point? So here, whenever you get such type of question and they are asking to calculate the odd ratio, you cannot do it directly. Make a table. Make a table. Always go with a table, Hana. First try to find out the values of ABCD. You know how to make a table. In the table, always take disease at the top. Always take disease at the top, and always take exposure at the left hand corner. Disease at the top and exposure at the left hand corner, and see ABCD. Try to fill the values of ABCD by reading the question. Read the question. They are saying total 50 patients and 50 controls. 50 patients, 50 controls. What is this 250-50 number given in the question? Hana, I'm telling you how to fill this table. Once you will get the values of ABCD, you know the formula of odd ratio AD upon BC. It's easy to calculate once you know the values of ABCD. But how to, decode the values of ABCD from the question that I'm telling you. So in the question you can read there are 50 patients and 50 controls. So 50 patients means the person in which the disease is present. So A plus C total is 50. And 50 control. So B plus D total is 50. You got my point? So this is total 50, this is total 50. That I got it. Now read the question ahead. So out of the 50 patients, 30 are smoker. What is this 30? And out of the 50 control, 10 are smoker. 10 are smoker. Huh? So out of the 50 patients, 30 are smoker. Means exposure is present in 30. So 30 is the value of A. Hana? So C is not given to you. So obviously C will be 20 because total is 50. So you have to judge that C is 20. The C value is not given to you, but you have to understand by yourself. Got my point? And out of the 50 control, 10 are smoker. You can see 10 are smoker. So exposure is present in 10. So obviously the value of D is 40. So once you get the values of ABCD, it's very easy now. You can do the cross product. So it is 30 into 40 upon 20 into 10. 30 into 40 upon 20 into 10. You can do the calculations. Okay. So answer will be 6. If you do the calculations, the answer will be 6. It's in front of you. How many of you got it? How many of you got it? So this is how we calculate the odd ratio. And now if you are preparing for your university exam for the third prof, these are the important questions which are usually asked from this topic. And if you're preparing for any competitive exam, we have done the numericals and we have done the conceptual questions based on this topic. So that's all about this study. That is case control study. If you want the notes of this topic and all other topics which I have taken on the YouTube, they are available and in the form of the PDF. You can download it. The link will be provided here only. Hana, wherever you are watching it right now, the YouTube, session, one of the link will be pinned. Once the session will be over, after that, here only the link of the notes will be pinned. So you can get the notes from there. Thank you so much. Here there is a QR code. If you wish, you can scan it. You can scan the QR code. By scanning it, you can connect with me on various social media platforms, that is Instagram, WhatsApp, Telegram, and and where I daily share your study material for your competitive exams. So I share the small reels daily and some notes and some important image-based questions I share daily. So if you want to get connected, you can scan it. And thank you for your kind attention and time, your precious time. There is a contact number. If you have any doubt in any of the topic which I have taught you, you want any support, study-related guidance, you can text here. So the contact number is in front of you. It's 9321001485. Thank you so much. Every Tuesday and Friday, we come live at 9:30 a.m. If you have any topic in your mind which you want me to take it on YouTube live, kindly text it on the same number. So we will schedule a live session on YouTube on that particular topic, from patho, micro, pharma, PSM, whatever topic is in your mind, from medicine, we will schedule it here. Okay, so currently we have taken the case control study. Now the next topic I'm taking from pharmacology is drug absorption, pharmacokinetics, drug absorption. After that we have drug metabolism, drug biotransformation. The next topic is the complement system from the microbiology, transplant immunology, chronic inflammation. So these are the topics we have decided based on the demand of the students. If you have any other topic in your mind, kindly let us know. We will definitely schedule it. Thank you so much. Thank you so much. Bye-bye. I'm just ending the session. Thank you so much. Bye-bye. Wishing you all the best.